Now I'd like to invite yet another extremely driven professional, Dr. Sharad Singh. He is the additional professor of radiation oncology, Kalyan Singh Superspeciality Cancer Institute. Dr. Sharad Singh.
Thank you, Parul. And at the outset, I would like to convey my sincere gratitude to Dr. Mohit for inviting me this evening. And I think I am keeping everyone from the dinner. We are already late, so I will just try to kind of rush. My job has been made a bit easier by the previous speaker. So, unlike his slide of conclusion, like my previous speaker, I would like to say that oncology is one thing where NGS is now more or less its role is now carved in stone, and it is helping us immensely. So, I will briefly like to introduce to the genesis of cancer and why we need precision oncology in light of this genesis. What is NGS? Comprehensive genomic profiling. As we know, this is the next thing, and this is going to be the future of oncology. So, as we all know, that there is this abrasion of DNA which sets all kinds of cancer rolling. Body is always in lookout for cancers, and many are killed, but some escape the body's natural immunity and they form cancer. You know all the basic definitions. I'm rushing through it. As we all know that the studies of past 1.5 centuries has led us to believe that cancer in itself is an organ system, and it follows the central dogma of biology that there is a DNA which gives rise to RNA and which translates proteins, and these proteins are the cause of various kinds of cancers. The flow of this genetic information from the DNA to the ultimate end product proteins is known as the central dogma of cancer biology. Normal cell as well as cancer cell development both have this central dogma, and challenges in treating cancers are many, and two are especially particular. Every tumor is different and every cancer patient is different, and that is how NGS comes into play, as we'll see in the further slides. We used to treat many cancers empirically. He said that about so many things about the lung cancer, and it was very illustrative that way back in 1989 there were two departments of pulmonary oncology in the University of Osaka. So, but we unfortunately in India, we of course are catching up fast since everything is now going from bench to bedside too rapidly because of the recent evolutions. And the empirical treatment is now being shifted to rather tailored and individualized therapies. And future of oncology is data driven, and it is backed with informed decisions. So that every patient, every individual patient is an individual patient, is an individual entity, and you don't treat patients empirically anymore. So precision medicine, which is also known as personal medicine, aims at identifying effective treatment strategies for each patient through better characterization of diseases at molecular and pharmacogenomic levels. As we all know, the basic epidemiology, we have about 1 million new patients per year. And next generation sequencing as we all know, it is the production of copies of genomic data so that we can study them more. Initially, it was very kind of sluggish, and as the technology has progressed, we have gone to have rapid copies, high throughput of the data, so that we can process it very rapidly. There has been advancements in technologies. The growth of personalized medicine and drug development has been there, and positive collaborations of research and industry has led to cost-effective solutions for cancer patients. Now, sequencing of thousands to millions of DNA molecules simultaneously is possible. High throughput approach with capability to sequence multiple individuals at the same time, and important, and it is going to be an important and irreplaceable tool in genomics. So, NGS versus traditional methods, there are multiple anomalies at different genomic scales which can be assayed simultaneously through NGS. It is more sensitive than the traditional Sanger sequencing, and single extraction and single test instead of multiple tests. And it is cost effective. The turnaround time, as I mentioned, is less, and tissue preservation, many genes simultaneously assessed from single extraction, and a potential for discovery of novel actionable agents. As we all know that now also through the development in the artificial intelligence (AI), many of the drugs are being generated through reverse engineering by identifying the genomic anomalies and extreme flexibility of analysis of different types. Advantages again are massively parallel sequencing capability, single input of DNA or RNA, and simultaneous screening of multiple genes in multiple samples, and better picture of human heterogeneity. This is very important because every individual, as I mentioned, has a different set of genomic alterations as compared to others. And quantitative and sensitive detection of genetic genomic aberrations is possible, and decrease sequencing costs per gene. And the technology is constantly improving, and that is why, as you can see the brochures maybe in front of you, the costs have come down tremendously over the period of last 5 years. So, as we all know, in all sequencing steps, there are sequencing and there is informatics are generated from them, and then analysis is done, and a report is generated as to what kind of specific alterations are there in the genome of a particular patient, so that tailored therapies can be given. So these are all comparisons. I will not go into the detail. Then comprehensive genomic profiling. This is the buzzword, and as we all know that it has been predicted that by in next 2 decades we will have a comprehensive analysis of whole of the genome, which will help us. And advantages of comprehensive genome profiling is that it covers all biomarkers present in guidelines, various kinds of alterations which have been detected, and it can help us in identifying the therapies which will be tailored to a particular individual. Why to waste or give unnecessary toxicity to a patient who is having a particular kind of genetic alteration? So the role of NGS in cancer is very vast. It is now available for almost all kinds of malignancies. We have now targets, and many of these are druggable, or they have radio therapeutic interventions which can help in cure. So one particular lung cancer, I have taken this as an example because Professor 𝗦𝗵𝗿𝗱 sir was to be here. I thought that this will be a case point in study. So broadly, we have always classified lung cancer into small cell or non-small cell. Then over the time, we also evolved into large cell adenocarcinoma, then squamous cell carcinoma, and so on. But all this was empirical. And now we have molecular spectrum where so many mutations are there. And believe me, this has changed the scenario. As sir was mentioning a patient he has seen yesterday only, I would like to say yesterday only I saw a patient whom I started with ALK modification therapy, ALK modifier inhibitor therapy, almost 3 years and 2 months now, and she is doing miraculously well. As we all know that median age of survival in stage 4 NSCLC is about 1.5 years at the best. Do you whatever. That was the data about 1 year back, but now the scenario is changing, and the lady is doing very good for almost 3 years now with one solitary liver mass. So, as we all know, all these things have been incorporated into our guidelines and are being used. And now the treatment is very, very tailored. We have programmed H cell ligand inhibitors, we have ALK cross modifications, we have so many things. TKIs were always there for almost last 1.5 decades. And we can predict about so many things, how the disease will behave. And we have a sequential targets, we have so many targets which we can take care of one by one, and so that patient can have an overall increased prolonged survival, and a disease which was a killer disease can be converted into a rather a slow smoldering kind of disease which allows the patient to live if we give good kind of supportive therapy and treatment. And very recently, there was a publication which says that if we are going to incorporate NGS into more of the diagnostics rather than a plain IFC, there is going to be tremendous benefit of survivals. A retrospective analysis, it is in publication. I think it will be available very soon. Thank you.